Good morning, myself Varun Kumar. Today we will see about a topic called pain. Pain. Usually pain is one of the sensory, which is the uncommon pleasant, where we feel in our own body. So, Pain is one of the most common reasons where the patients seek physiotherapy. So it may be acute or chronic or localized or generalized. So the pain can be a acute one. So within a 2 days or within a 2 weeks, it will be considered as the acute pain, or more than 2 weeks or 2 months, it may be considered as the chronic pain. Then it may be a localized or generalized. So localized, the patient's complains the pain over a particular area. It may be called as the localized pain, or the patient having the pain over the different areas. It may be a generalized pain. So the pain is uncontrolled pain, which reduces the participation of the patients in rehabilitation and it lowers the quality of life. So understanding the mechanism and management is essential for effective rehab. So the different kind of pain, there will be a different kind of background mechanism, and the management is vary for each kind of mechanical or mechanism of the each kind of the pain. So for that we have to know the understanding the mechanism and management of the pain. So theories of pain. So in that pain, there's a different kind of theories. The first one is the specificity theory. So here the pain arises from the specific pain receptors transmitting the signals to the brain. So whereas in gate control theory, which is coined by the Melzer and Wall in 1965. So here they mentioned that the spinal gate or spinal pathway, which regulates the pain signals. So usually there's a large diameter fiber which is responsible for the touch pressure can close the gate, whereas the small diameter fibers or the pain receptors maybe open the gate. So basically, it can be dumb or it can be tolerable by means of the basis for tense and massage therapy. So next kind of theory is the neurometrics theory. In that neurometrics theory, the pain is in what they're conveying is the pain is a multidimensional experience influenced by the sensory, emotional, and then the cognitive factors. So different types of pain. So in that unpleasant sensation, that may be vary from like a burning, like a radiating, or like a pin prickling. So these are the different types of pain. So it can be classified as the nociceptive pain, which is from the tissue damage. It may be due to the fracture or arthritis. Next type of pain is the neurobaric pain, whereas it can be occur from the nerve damage. Example like the sciatica or diabetic neuropathy. Next one is the psychogenic pain. It may be influenced by the emotional or psychological factors. Then myofascial pain syndrome, where the pain is from the muscle trigger points. So assessment of pain. So before entering into the rehabilitation, we have to assess the exact pain. So in that assessment, first one we need a history. So in the history collection, the pain onset. So whether there may be a sudden onset of the pain or a gradual onset of the pain, then duration. So how long the pain is being presented. Then what are the factors which leads to the aggravating that pain, and then we have to know what are the factors which may be relieve that pain. So here we can use the scales like visual analog scale or numerical rating scale or McGill pain questionnaire scale. So in these three types of scales, they are commonly used only for analyzing the pain or severity of the pain, whether there may be a mild pain or a moderate pain or a severe pain. So based on that scales, we can able to know the severity of the pain so that we can make a framework the treatment or management for that pain. So in observation, we can observe the facial expression of the patient and their posture due to the pain, and also the movement limitation due to the pain. So due to the pain, the patient may go for different facial expressions, and also they can't able to adapt a particular posture for a more time. Then there will be a movement limitation due to that pain. So these are help to find out the therapeutic managements for the pain. So in the therapeutic management of the pain, usually we can start from the electrotherapy modalities. In the TENS, so TENS is one of the electrotherapy modality which can be used to only for the pain relieving modality, where it controls the pain gate mechanism. Then IFT, it uses to reduce the muscle spasm so that the pain will become reduced. So ultrasound, it produces a deep heating effect. So far, it used for the soft tissue pain. So laser, it reduces the inflammation. So thermal therapy. So in the thermal therapy, cryotherapy also used, then heat therapy also used. So depends upon the duration. For acute injuries, we can go for the cryotherapy. For chronic pain, we can go for the heat therapy. So exercise therapy. In exercise therapy, the stretching exercises, strengthening exercises, and then the aerobic exercises are used for reducing the pain by means of the improving the blood circulation, so that there will be releases of the endorphins. So the manual therapy. So in that manual therapy, so joint mobilization is one of the technique, and then soft tissue mobilization is one of the technique used for reducing the pain, stiffness of the joint, and also we can go with the massage technique. Then relaxation technique. In relaxation technique, the deep breathing exercises, progressive muscle relaxation exercises, yoga exercises, and then meditations are used for reducing the pain. So in pharmacological, analgesics, non-steroidal anti-inflammatory drugs, muscle relaxants, and then various neuropathic agents can be used. So myofascial pain syndrome. So myofascial pain syndrome is one of the pain where it arising from the trigger points in the skeletal muscles. So the features of this myofascial pain syndrome, it may be there may be a localized tenderness exactly in the trigger points, and there will be a referred pain pattern and also palpable the taut band. So management for this, we can go with the stretching and spray techniques. There, and also we can give a ischemic compression of the trigger points. Then we can go for the dry needling. Then we can go for the strengthening and then the posture corrections. So role of physiotherapist. So role of physiotherapist in the pain management, we can identify a source of the pain and contributing the factors. Then we apply the safe and effective modalities exactly to the pain area. Then we can educate the patients about their posture, ergonomical changes, and then the relaxation techniques. Then we can encourage the graded activity rather than the rest alone. So work as part of a multidisciplinary pain management team. These are the major role of physiotherapist in the pain. So then we can see about a case example. Here the patient is 40 years old, a female with chronic low back pain. So the rehab plan mainly focuses on the heat therapy before exercises. Then we can go for the strengthening of the core muscles and stretching of the core muscles. Then we can go for the ergonomic advice for the patients in their workplaces. Then we can go for the tents for get the better pain relief. So these are the today's topic, and how we can handle the pain by means of the therapeutic techniques. Thank you.